All right, so as we said earlier, points on Yangming channel, or the Yangming channels, are abundant in qi and blood. Points of foot Yangming, the stomach channel, can be used to regulate qi and blood in the lower limb and to treat weakening of the muscles, atrophy, and painful obstruction, or hemiplegia, right, one-sided paralysis of the lower extremities, and pain of all kinds. Apart from that, because of the pathway of the channel, we can say that the points can be used to treat facial deviation, toothache, jaw pain, ear pain, eye pain, chest pain, pain in the abdomen, pain in the lateral aspect of the lower limb, disorders of the stomach and large intestine fu, as well as the heart, lung, and spleen. And also because of these connections with the uterus and bladder, points on the channel can tonify qi, blood, yin and yang, and can be useful in treating disturbances of the spirit, especially mania and depression. Now we take a look at our Luo connecting channel. Allow me just to change my options. There we go. Okay, the Luo channel begins at stomach 40, the Luo point, and there's a deep connection with the spleen channel, which runs on the anterior medial aspect of the lower extremity, and then it ascends the anterior lateral aspect of the lower extremity, crosses the inguinal region, and arises through the abdomen, chest, to the throat where it splits. And there's a branch that ascends to the nape of the head, neck, where it meets with the qi of all the yang channels, and then it terminates in the throat. Yeah. And just we can take a quick look at the divergent channel. But it diverges in the anterolateral aspect of the thigh, and again passes through the inguinal region, runs up, connects with the stomach, the spleen, right here, and the heart, crosses the throat, runs up the side of the nose, meets the bladder channel, right, and curves around, comes to the eye. So again, we see how the connections of this channel make it possible to have all those functions: nose, teeth, gums, eye, heart, chest, particularly anterolateral portion of the lower extremity. Right? There are all of these connections of the different channels belonging to the primary channel of stomach channel of foot Yangming. Right? And now we see our sinew channel or tendinomuscular channel. Right? It arises at the second through fourth toes, right here. Moves up the lateral aspect of the tibia to the knee. Continues at the lateral aspect of the thigh and connects to the genital region and umbilicus. Okay. Moves up through the torso, up the side of the neck, and connects to the side of the nose. A branch goes to the ear, and a branch meets up with the sinew channel of the urinary bladder and forms a web around the eye. And then we see that a branch comes in front of the ankle and moves laterally up the leg, crossing the gallbladder channel and connecting with the lower thoracic vertebrae. So we have hand Yangming the large intestine channel, connecting with the upper thoracic vertebrae, and foot Yangming, stomach channel, connecting with the lower thoracic vertebrae. The points on the stomach channel of leg Yangming, the entry point, as mentioned earlier, stomach 1. The exit point, stomach 42. This is also the Yuan source point. Stomach 40 is the Luo connecting point. Stomach 34 is the Shi cleft point, a point that is abundant in qi and blood. The front mu point is Ren 12. That's the front mu point of the stomach fu. And the back shu point is urinary bladder 21. And we see here our antique or transporting points. Yes, our Jing well, the extreme, the terminal end of the channel, stomach 45, associated with metal. Our Ying spring point, stomach 44, associated with water. Our Shu stream point, stomach 43, associated with wood. Our Jing river point, stomach 41, associated with fire. And our He point, stomach 36, associated with earth. And this would be the earth point on the earth channel, so it would be the Harari point. Let us look at our entry point, Chen-Chi, containing tears. With the eye looking straight forward, the point is directly below the pupil in the space between the eyeball and the infraorbital ridge. Okay, so it's between the eyeball and the bone. Okay, we can take a look here. Yes? If we look right here, we see the eyeball and the infraorbital ridge right here, and the point, right? Chen-Chi, stomach 1, right here. Okay. It is actually an excellent point for all kinds of eye problems, particularly excess lacrimation or tearing, which is why the name of the point is containing tears, right? Because it's great for excess lacrimation. Okay, that means tearing of the eye. So with the eye looking straight forward, the point is directly below the pupil in the space between the eyeball and the infraorbital ridge. It expels wind, brightens the eyes, and stops lacrimation. Those are the actions. So the indications would be redness and swelling of the eye, lacrimation or excess lacrimation, tearing, night blindness, twitching of the eyelids, and facial paralysis, right? We see facial paralysis, twitching. Those would be signs of wind, and the point expels wind. Brightens the eyes kind of means sharpens the vision, right? So we see night blindness, right? And redness and swelling often can be signs of heat. And we talked about points on the Yangming channels being good at dealing with excess yang conditions, clearing heat. Okay. Stomach 2, Si Bai, which means 4 whites, which relates again to clearing, brightening the eyes, and clearing redness from the eyes, so that the 4 corners of the eye, the whites of the eyes, are white and not red. Okay. This point is directly below the pupil, level this point is directly below the pupil in the depression of the infraorbital foramen. Okay, this is not a point that you are responsible for on the syllabus, but you can see here, and here's the infraorbital foramen. Here's a picture of the bone, and here's a picture with the skin over it. Yeah. Yes, directly, if you're looking straight ahead, directly below the pupil. Okay. Sorry. Here we are. Okay. So Si Bai is a good replacement for Chen Qi. Stomach 2, a good replacement for stomach 1. Often acupuncturists who are not yet comfortable needling into the area around the eyeball, because there are several points in this area, will use stomach 2 as a replacement. And I certainly would recommend that for massage therapy if somebody has excess lacrimation, eye pain, redness, swelling. You can use this point instead of kind of poking your finger into the eye socket, because that's not very pleasant. Okay. Stomach 3, Juliao, great bone hole. This is the meeting point of the 3 leg yang channels. So urinary bladder, gallbladder, and stomach. Directly below the pupil at the lower border of the ala nazi on the lateral side of the nasolabial groove. Right? We talked about the nasolabial groove previously when we talked about the location of yin xiang, welcome fragrance, which is large intestine 20. Right? We will cruise through these for a second, and we'll show you right here. Right here is Juliao. Yes, right? Just lateral to the nasolabial groove at the level of the lower border of the ala nazi. Here is yin xiang. Right, welcome fragments, large intestine 20. Midpoint of the ala nazi on the nasolabial groove. Okay? And here is stomach 4, Dikang, which we will also talk about in a moment. Right? But you can see, so stomach 1 would be here, 2 here, 3, 4. Right? And here the channel, from here the channel goes here, right? Meets with the governor vessel. Here, meets with the conception vessel, and then it moves this way. Yeah, and then stomach 5, stomach 6, stomach 7, stomach 8, a half a sun inside the anterior hairline, and 4.5 sun lateral to the anterior midline. Okay, but now we are talking about Julia. Stomach 3, great bone hole. Directly below the pupil at the lower border of the ala nazi on the lateral side of the nasolabial groove. Expels wind, removes obstructions from the channel, and relieves swelling. So wind, facial paralysis, twitching of the eyelids, epistaxis, which is nosebleed, toothache, swelling of the lips and teeth.